I'm just going to ask the first question and give other people a chance to put some things in here. The need for collaboration. Again, I've been going to committee meetings for at least 30 years on this. And, you know, it's deja vu. We've been saying these things for 30 years, but we don't implement them. One of the things we sorely need, from my perspective, you covered very well, Dr. Whitehead, was the need for integration. Not just collaboration. We need integration. We need integration at the graduate and undergraduate education level. We continue to produce doctors out of a silo, nurses out of a silo, and then all of a sudden we expect them to play kumbaya years later. And I just think those paradigms have to change. When I first started in this with the AMA, we had a couple of studies done. For nurses and doctors, about 80% had to recognize the obligation you spoke to and Jeff spoke to respond. When you asked them the corollary question, are you ready? Have you been trained? 80% said no. About 5 years ago, they had a kind of a follow-up study with that. And over all that time and all the disasters and all the discussion, the numbers of people who felt trained went all the way from 20% to 25%. You know, so we're missing something. So the question I have been asking throughout the day, I'd like to pose to you and to Jeff. If there was a single change that you see needs to be made in the educational system of health professionals to help fill the deficiencies that we have, what would it be?
Great question. Yes, we have been talking about this for decades, and this is not rocket science, but it's certainly hard to and implement. I think part of the issue, to your point, are the silos that occur in our education. And of course, each discipline so important, but when we tend to get educated in silos and then practice in silos. And so I think that part of the issue is how can we foster and integrate interprofessional communication and opening up the doors so that we are working together as a team and not the hierarchical kind of structure that exists. Let's be honest, the current system fosters continuation of those silos. And then when you get into, I agree with you, I don't feel like I was adequately prepared when I came out of nursing school, or even, I'm not so sure I would say I'm proficient now at it. The training, how do we respond? How do we ensure that we are doing this correctly? So I think part of it is forums like today that we are continuing the conversation. And I think being able to, those of us who are in academia, to be able to go back and to be able to start to shift and to role model how we operationalize and work together as teams. And I think the ethical principles that we are seeing, they translate across all settings, not just disaster medicine, right? When we open it up. So if we can have a fundamental framework that we start to infuse early on within all of the professions, it can help us translate beyond. And most certainly being aware of the social injustices. How do we promote more diversity, more inclusivity, and equitable equality into how we train and how we practice, and also reflection of professionals from the communities, right? You don't reflect what our communities, the most vulnerable communities, look like. Thank you.
Absolutely. Jeff?
Yeah, I agree with all points. I should note, I'm not, just to clarify, I'm not a doctor academically or clinically, but I do take your insurance. So, but yeah, I mean, I think a lot of it too is that, we are shockingly good at predicting inequalities. That's the easy part. The hard part is how do we actually change behaviors? And I see this a lot where folks sort of call for change and we say, one of my favorites is we need to be less polarized, which usually means you need to think more like me. And so, but I think that there is, and I'll give a very specific example. I was with a group that I probably shouldn't name, and we were in a conference room in Puerto Rico talking about, NGOs and how they could better. I mean, the first question right out of the gate was, how do we get communities to work better with us? And I'm like, oh, gee, okay, this is going to be a bad meeting. Anyway, the only exception, one person in the whole room was from Puerto Rico, and that happened to be a local representative of an international NGO. So my first thought was, go outside. I think that the investments need to be shifted to be focused more on the communities that aren't realizing the benefits of these systems. On the clinical side, maybe it means rotations through local community health centers, things like that. Maybe on the academic side, maybe it means sort of looking at, where are you getting your sources? Are you bouncing around of people and then mining for sources from there? Because then you're probably missing important areas of research that aren't as connected to what you're familiar with. So it really comes down to the way we operate and having to take a hard look at that, and also acknowledging going in that we may have to do things that put more money in places away from ourselves. I speak as someone from a position of privilege, and that to really start thinking through what those sacrifices are and what the increased cost of doing business is to actually start to reverse inequities. It's an easy thing to talk about. It's an easy thing to promise. It's a very, very, very difficult thing to actually undo. And so we need to give it that level of attention and effort as something that's very difficult and very important.